we see the political will, be it in the area of health financing, where we feel that the Minister of Medical Service takes a strong leading position in Kenya, but even beyond Kenya, in setting the African agenda on healthcare financing. We know that in the area of reproductive health, of family health, the Minister of Public Health has taken internationally a strong position to mobilize resources and to make healthcare accessible to all Kenyan women, families and men. The private sector is not to give money away. The private sector is to make money in order to do its work. They need to make money, for example, in order to give away money in the framework of social responsibility programs. For example, I think an outstanding example in Kenya is Nairobi Women's Hospital. It's a private, for-profit enterprise with a very strong social objective, which is to treat any woman, any child that has been violated free of charge. And I think these organizations like this do a fantastic job inside the health sector, like Nairobi Women's Hospital. Outside the health sector, there are many corporates talking about Safaricom, talking about Coca-Cola, and so many others that contribute to this success. Let me go maybe 18 years in the future. This is when the Vision 2030 will have reached, hopefully, its goal, and we will have Kenya developed to a social market economy. My vision would be that all Kenyans have access to a basic package of healthcare, and for those who cannot afford, the government will will have to pay, that people have solidarity, understanding, and that the more wealthy will pay more and the poorer or the less wealthy will pay less. I believe that Kenya will make great progress. It has the infrastructure, it has a tremendous workforce, bright people, it has an infrastructure of schooling, of universities, and it has the political will to develop. And I think if the country maintains peace, if the different interest groups come together, I believe this country has a great future. Policy frameworks are about values, and a nation can only move forward if there is agreement between the different interest groups in society, the different groups about those values. And this is in the level of culture, this is in the level of ethnicity, it's on the level of how to bridge the gaps between the different provinces, between the different regions. It is on the level of religion, so that we have incorporated Muslim values, that we have Christian values and other values. So a health policy framework must reflect the way forward on where do we want to reach by the year 2030. To do that, I believe that those who are writing the policy framework must include the public and all these interest groups very urgently and very intensively. We have seen now that government has started disseminating the results, that dialogue is being established. It comes maybe a bit late, but it is there, and I hope it will be intensified. A health policy framework is not a document that is being conceived and designed in Afia House only. It is owned by the Kenyan people, and I think the process must reflect this. Well, when I used to complain to my mom as a young boy, when I said it's so difficult, my mother said, whoever said it should not be difficult? Of course it is difficult, it is never easy, it is never smooth. Changing things, and our work is about changing policies, changing the mindsets of people, changing conditions of people where they live in and which are miserable. This is a world of interests and of conflicting interests sometimes, and we have experienced quite some difficulties. Um, there were challenges like the post-election crisis, where we had difficulties. We stayed on, we stayed with the Kenyan government, but it was not an easy time on a personal level, but of course also on a level of work. Most important aspect of my personal life here was to work with great people in my own team. I have met so many good people, and we grew together in in the partners, be it in government, be it in the private sector. I've found great people where we communicate on the same level. This is not a country where we look down to our partners. This is a country where we learn from each other, and I have enjoyed being here, and I will definitely be back, not as heading the health program, but as a tourist, also as a teacher, and maybe in some other capacity. Well, I guess the Bible somewhere said, if you don't have the love to what you're doing, to love to the people, everything is in vain. So I think I'm passionate about what I'm doing. I love what I'm doing. I'm a doctor by profession. I love to be a doctor, and I want to leave something behind in this world that gives meaning to my life, to my family's life, but also to the people I work with. And in Kenya, I have found ways of creating meaning, I hope creating meaning to people that has motivated me, and I'm still passionate. And I hope I will be passionate for many years more to do, because that's what motivates us and keeps us going. And I'm taking a leave, and I'm taking a deep breath, and I plan to go to Southeast Asia to work there for a year. I have been asked to support a major health program there, and I think after that I will reflect about my life. I will then go close to retreat age and pension age, and I will start doing what people in this age do, writing our books, teaching and sharing my knowledge. I have a great passion in teaching, and being a good father to my children, which I didn't always have time to see them during my time in Kenya and earlier, or maybe my grandchildren.